Today we're going to be looking at our overhead squat movement assessment. So how we're going to perform this test is our arms are going to be up by our ears, correctly bisected to our ears. Our torso is going to be nice and neutral. Our feet are going to be about shoulder width apart. We're going to perform 5 reps anteriorly, laterally, and posteriorly. So we're just looking for a whole neutral body line, no compensations. It should look something like this. So right now we're going to be looking if we see forward arms, a drop chest, asymmetry in our hips, or any knee valgus or varus. So Jennifer, put your arms up. Shoulder width are apart. I'm going to have her scoot back until right here so we can watch her full body and perform that squat for me. So as you can see, come up and do one more. And freeze. Her knees are in and her feet are flattening, which is excessive pronation, causing that knee valgus. One more for me. Yeah, so perfect. So as we see there, we had that excessive knee valgus caused by the excessive pronation or feet flattening of the foot. This could be caused by either overactive peroneal complex, because those are our everters, or our TFL, or even our lateral gastroc, and then some possible underactive muscles would be our anterior or posterior tibialis, because those are our inverters. So for this next part, we're going to be starting our corrective exercise continuum, and that first phase is going to be inhibitory methods. So this can be used by multiple ways, but today we're going to be focusing on self-myofascial release. So you can do this by foam rolling with either a foam roller or with a tennis ball. We're going to be using the foam roller today just because we're going towards like a bigger surface and bigger muscle, but you can use a tennis ball for smaller areas of the body. So we're going to be focusing on inhibiting the overactive muscles that are causing our foot pronation, which could be multiple muscles as listed, but we're going to be focusing on our peroneal complex. So how we're going to do this is we're going to take this foam roller and we're going to do this as frequently as needed. It's normally done about once a day for one set, and depending on pain tolerance, you can hold it for 30 seconds max pain tolerance or to 90 seconds for minimal pain tolerance. So how we're going to perform this is we're basically going to get into like a lateral plank type position. If that is too difficult for any of the clients you're working with, you can move your body parts to help with holding up that body weight. But you're going to get this foam roller and place it on the lateral side of your shin, and you're going to get into your plank positions and pop up. As you see, I'm going to bring this foot forward or backwards to help, but forward will allow us to trigger that point. You can use this hand right here or for more support, or you can rest this up, and you're going to be rolling slowly, controlled until you find that trigger point. Once you find that trigger point, depending on pain tolerance, you're going to be holding for 30 to 90 seconds. Okay, Jennifer, I'm going to have you do this now. I have placed Jennifer in the correct position to be getting her that trigger point on her peroneal. So remember, we're using this on overactive muscles to inhibit that muscle. So you're going to roll slowly and controlled until you find that trigger point, aiming for about right here, and you can use this hand for support. You found that trigger point?
Oh yeah.
Okay, so hold that there. 30 seconds for max pain or 90 seconds for minimal pain, and we'll sit here and we can do this to both sides since we saw pronation on both feet. Perfect. So the second phase of our continuum is going to be our lengthening phase. So this can be done by static stretching or neuromuscular stretching, also known as PNF stretching.
No.
So we're going to be doing static stretches today, and this is going to be done for about 1 to 4 reps with about 30 to 60 second hold at your end range of motion. You're just going to reach to your end range of motion, slow and controlled. Once you find that spot, hold for 30 to 60 seconds. So we're going to be doing our gastroc and our biceps femoris. So for our gastroc, we're going to find a wall right here, and you're going to get into this positioning, and you're going to bring one foot out and one foot in, and you're going to lean into that foot, adjust where you feel that stretch, and this is where I feel it best. And we're going to hold this for 30 to 60 seconds, and then you'll switch sides. So Jennifer, come over and do this for me. Straight arms, neutral body line, one foot in front. Now lean and bend that back leg. And then straighten. Do you feel it better? Straighten or bend?
Bend.
Perfect. Yeah, so go to that bend position. Bring that back foot in a little bit for me. Now go into, and we're going to hold this. Perfect. So see how her body's neutral and she's leaning into this gastroc right here. Now switch sides for me. Bring that back foot in a little bit. Keep those arms nice and straight. Perfect. And we're gonna hold this again for 30 to 60 seconds. And this is gonna be help lengthening our gastroc, which is a commonly shortened and overactive muscle causing feet pronation. Other muscle that we could help lengthen with our static stretching could be our biceps femoris. So this one, we would be laying on the ground, bringing our foot up and pulling it across us. So it's gonna look like this. And we're gonna be pulling this, and we're gonna be holding this for 30 to 60 seconds, doing about 1 to 4 reps on each side. So Jennifer, I'm gonna have you lay down. Back flat, both legs flat, pull one leg up, and then use your own hand to pull it across and keep this leg flat. Try to grab a little bit higher and try to keep your torso on the ground. So I'm gonna have you straighten your leg, hold, and casually pull like this. Yeah, so I saw that look on your face, you feel it a little bit more. We're gonna hold this on both sides for about 30 to 60 seconds for 1 to 4 reps. Perfect. What we're going to do is our activation phase. So we're going to be working on strengthening our underactive muscles. So this is what we're going to go to, whoa, let me restart.
Your necklace is awesome.
I know.
Don't get me so bad. Your
Sorry.
face back there. You have like a knot though. I don't think it'll go.
It will. There it is. Alrighty, so our next phase is going to be our activation. You can't laugh!
I was just thinking you really don't match.
No, I don't.
Your shorts
It's
are
fine.
super wrinkly.
It's fine, I don't get graded on how I look. Alrighty, so our next phase is going to be our activation phase. So we're going to be working on activating our underactive muscles. So one muscle that we're going to be working on today is our anterior tibialis. And one of the actions of these muscles is inversion. And since this muscle is underactive, that's why our feet are more capable of doing our pronation, feet flattening. So today I'm going to have Jennifer lie down on this floor, and we are going to use this resistance band, and we're going to pop it on our toe in our middle of our foot, and we're going to scoop back, and she's going to be right here. She's going to be in plantar flexion. She's going to pull so she has a stretch. She's going to lift her toe up slowly. We're going to have a 2-second isometric hold, and then she's going to release back to plantar flexion with a 4-second eccentric. So like I show, we're going to pull, 2-second hold, 4-second eccentric, and this is going to help with strengthening, strengthening our anterior tibialis. So pop that onto your foot, and then put your foot in plantar flexion, so toes down, straight legs, and then scoot back even more so you have that resistance. Perfect, now freeze. Now you're going to lift up, hold for 2 seconds, and then slowly 4-second eccentric down. She's going to do this about 3 to 5 times a week with about 1 to 2 sets, maybe with about 10 to 15 reps. And she's going to do this on both sides. This is going to help activate that underactive anterior tibialis that is causing the foot pronation to occur. Alrighty, so this last phase that we're going to be doing is the integration phase. So this is just going to be our isometric strengthening techniques. So what we're going to do is I'm going to have Jennifer, we're going to be working on our underactive anterior tibialis. So I'm going to have Jennifer give me, scoot back a little bit so her legs are just flatten those legs, and I'm going to be working on her anterior tibialis. So what I'm going to have her do is I'm going to have this, get her foot, and I'm going to have her go into dorsiflexion, and I'm going to have her force against her, having her to try to go into plantar flexion. Since the anterior tibialis is responsible for plantar flexion, I'm going to be applying force in the opposite direction. We're going to do this frequently as needed for about 1 to 2 sets with 4 reps, and we're going to do 4 different isometric variations with 25 to 100% force. So what I'm going to do is I'm going to have her grab this foot. I'm going to stabilize right here on her gastroc. I'm going to push her into dorsiflexion right here. Rest your toes, just relax. And I'm going to have her push to me like you're, yep, perfect. 25% effort, relax. Good. Now I'm going to have you go a little bit harder. Good. Now she's forcing into my hand for that plantar flexion. Relax. Now we're going to do 75% effort. Good. Perfect. And then one more at 100% effort against me. Good, now rest. Last two exercises that we did were our activation for strengthening and isometric strength. This one is going to be our integration dynamic movement. So what we're going to have Jennifer do is we're going to have her lean up against this wall right here, and we're going to be working on our anterior tibialis still. So we're going to lean up against this wall. We're going to be flat. We are going to lift the balls of our feet up. You can use the wall for support, holding that, and then resting. If she needs to scoot out her feet for better support, that's fine too. We're going to have her lift, hold, and then lower. Lift, hold, and then lower. You can kind of know as toe lift, this is going to be strengthening our anterior and posterior tibialis. That are some of our underactive muscles with our overhead squat assessment. Good, hold and relax, and then up, hold, relax. So this is just going to be working our inverters, our foot inverters that are weak when we showed our overhead squat assessment. And one more. Good. So for the integration dynamic movements, we're going to be doing this for 1 to 3 sets for about 10 to 15 reps. We just want these reps slow and controlled just to get all the muscles that we were strengthening and inhibiting in the past all working together as a full body movement. Alrighty, so after the corrective exercise continuum is complete by the client, the goal is to have all muscles working properly. We don't want any underactive, long, weak muscles or overactive, short, tight muscles. So we're gonna have Jennifer perform the overhead squat assessment one more time. We're looking for straight arms glued to the ears, inline torso, knees and ankles in line, no knee movement, no hip movement, and no ankle movement. So Jennifer, arms up, posture. Good, so as we see, she does not have any knee valgus, which she previously had. And if you're looking at her foot, we don't see any foot pronation. Jennifer, I'm gonna have you go laterally and perform 2 more reps. She's keeping her arms glued to her ears. We don't have a forward chest drop. We see no knee movement, and we see no heel lift or foot pronation. Our original issue was that foot pronation, feet flattening, and as we can see, after completing the program for a couple of months, she no longer has that issue.